I think other physicians should take the opportunity to review the Choosing Wisely recommendations and use it as a springboard to have discussions with their patients around the appropriateness of diagnostic testing and treatments for various conditions. It's really an opportunity to have a discussion.
I think it's really important for doctors to discuss this with patients. Patients come in and they've heard of a test. It's not their job to know what the side effects of that test are or what their pretest probability is. And it's our job to look at that and discuss it with them. And really when you discuss these things with patients, they find it refreshing because you're spending time actually talking to them.
When I'm working with a patient or when I'm with that patient and discussing what my plans of treatment would be, I like to discuss with them and encourage them to ask me questions about this particular prescription, about what the tests are. I think it's important to have that conversation. The patient needs to understand, needs to have the knowledge, needs to have the power about making informed decisions for themselves.
And I understand from a patient standpoint that a lot of times they want an answer. And for example, if I deal with a lot of people with low back pain, you may not always agree what the sore thing is in your back, but we can sit together and say, yeah, you have a sore thing in your back. And the tests that we get done may or may not change how we're going to manage that sore thing. So instead of putting you through the time to get the test and the potential risks of a test, we need to be able to sit with them and explain to them what their expectations are, understand their expectations, explain to them what our expectations are, and again, find the middle ground where they can understand why we're suggesting a certain test or not. And I think that we need to have that discussion both when we're not suggesting a test and when we do suggest a test. So I think it's something that is on us to kind of educate our patients, because I think with more knowledge and more understanding, I find anyway, it's much easier to treat people.
For a physician to do the right investigation, for the right patient at the right time and interpret the results correctly, they need to take a proper history from the patient and they need to do a proper examination. Now the patient's role comes in here. It's very important that the patient knows they have a role here to play, because they need to make sure they give the physician the correct history and they give the correct symptoms of whatever they're complaining of. Because this really does help the physician to select the proper investigations. Without them, they may be kind of groping in the dark rather for this, that or the other, but the patient can help the physician to focus on the right investigations and hence save time.
The doctors can't do this by themselves. The patients have to come with them. And my hope is that patients will actually start saying to doctors, but do I really need this test? Is there any way this test could hurt me? Is there any way that if this test is positive, that it's wrong and I'll have to have another test? When a patient questions my recommendation to have a test or a procedure or a prescription, it's actually very useful to me. It already tells me the patient's engaged in the process, and it gives me a chance to explain to them what I'm thinking.